Hello, welcome to the VetSpace module on iodine in livestock. My name is Dr. Peter Pulford. I'm a veterinarian and I work for Elanco, New Zealand. The significance of iodine is often overlooked in livestock production, yet deficiency has been well known in New Zealand for many years, particularly among pregnant sheep fed brassica crops and occasionally also in dairy herds. Brassicas such as kale and swedes have low iodine content, but they also contain what are known as goitrogenic compounds that interfere with the animal's iodine metabolism. The iodine concentrations in pasture typically range from 0.08 to 0.24 milligrams of iodine per kilogram of dry matter. Plants don't require iodine to grow, so their iodine content and the soil iodine are not necessarily closely correlated. When grazing animals' dietary iodine intake is low or goitrogens are present in the diet, insufficient quantities of thyroid hormones are produced, and this may lead to clinical signs of iodine deficiency. Newborn livestock are particularly susceptible and may have high perinatal mortality, low birth weights and goiter, which is an enlargement of the thyroid gland. Goiter has also been observed, albeit rarely, in New Zealand flocks fed only on mixed sward pastures. Dietary iodine is readily absorbed by the rumen, reticulum and omasum. The absorbed iodine is taken up by the thyroid gland, where about 80% of total body iodine is sequestered. Routes of iodine loss are through the feces and urine. Iodine can pass into milk and cross the placenta where it is taken up by the fetus, especially during the third trimester when the growth rate is at the greatest. Within the thyroid gland, iodine is oxidized and bound to tyrosine to form monoiodotyrosine and diiodotyrosine, which are precursors of the prohormone thyroxine, also called T4. T4 can be considered a reservoir for the production of triiodothyronine, or T3, which is the metabolically active hormone. T4 and T3 are released into the blood to be transported in association with binding globulins. Circulating concentrations are very low. In ewes, serum T4 is 45 to 70 nanomoles per litre, while serum T3 is 40 to 50-fold less at 1.4 to 2 nanomoles per litre. The concentrations of serum T4 and T3 are controlled through a negative feedback loop. A decrease in T3 triggers the release of a thyrotropin stimulating hormone, or TSH, from the anterior pituitary gland, which then stimulates the uptake of iodine by the thyroid gland, leading to the synthesis of more thyroid hormones. Conversion of T4 to active T3 also takes place on demand in peripheral tissues such as liver and kidney by selenium-dependent iodothyronine deiodinase enzymes. Thus, selenium deficiency can influence iodine metabolism. Thyroid hormones stimulate oxidative metabolism in all cells and regulate energy metabolism and protein synthesis, and affect cell differentiation in tissues such as the brain, central nervous system, gonads, lung, heart, skin, and wool follicles. Management of iodine nutrition is complex due to the presence of organic factors in the diet, collectively termed goitrogens. These include thiocyanates that interfere with the uptake of iodine by the thyroid gland, while thioureas inhibit enzymes that incorporate iodine into the tyrosine precursors of thyroxine, and along with thiouracils, inhibit enzymes that convert T4 into T3. In New Zealand, the most common sources of goitrogens are forage crops used for winter supplementary feeding of livestock, typically kale, rape, and swedes. These contain glucosinolates that release thiocyanates during the chewing and digestion process. Thiocyanates are also produced from the white clovers that are ubiquitous in mixed swards, but the quantities and effects are small. When goitrogenic crops are fed to pregnant ewes during the latter half of gestation, compromised iodine metabolism can cause severe goiter and reduced birth weight in newborn lambs. The impact of thiocyanates, but not thiouracils, can be resolved by increasing dietary iodine intake or parenteral iodine supplementation. The minimum iodine intake required to ensure optimum performance and health of grazing livestock has been difficult to establish. This is primarily because of the variable influence of dietary goitrogens, which are technically difficult to identify and quantify in feedstuffs. Their concentrations in forages and in ryegrass white clover pastures change with botanical composition, season and farm management. As a guideline, 0.2 to 0.25 milligrams of iodine per kilogram of dry matter should be sufficient for sheep and cattle under most circumstances. Unfortunately, there is only scant data available from formal iodine dose response studies. For instance, ewes on pastures containing 0.1 to 0.18 milligrams of iodine per kilogram of dry matter had high lamb mortality until they received iodine supplements, and goiter occurred in lambs of a flock grazing pastures with average iodine concentrations of 0.15 milligrams of iodine per kilogram of dry matter. For cattle, in one study, it was estimated that 0.18 milligrams of iodine per kilogram of dry matter was required, while dairy cows consuming only slightly more iodine, with a pasture average of 0.24 milligrams of iodine per kilogram of dry matter, showed no milk yield response to 3 injections of 2,400 milligrams of iodine, or to daily oral iodine supplements. For cattle reared under Northern Hemisphere systems, the National Research Council of the US National Academy of Sciences, or NRC, suggest iodine intakes of 0.6 milligrams of iodine and 1.5 milligrams of iodine per 100 kilos of body weight for non-lactating and lactating cows respectively. For 500 kg cows, that equates to diets containing approximately 0.25 milligrams of iodine per kilogram of dry matter or 0.42 milligrams of iodine per kilogram of dry matter respectively. However, a production advantage from the higher recommended dietary iodine intakes has not been demonstrated in New Zealand. The signs of iodine deficiency are consequences of perturbed thyroid hormone metabolism. A characteristic feature is goiter caused by enlargement of the thyroid gland as it attempts to compensate for inadequate supply of iodine. Histology of goitrous glands from sheep shows diffuse hyperplasia and follicles of irregular shape, especially with follicular infolding lined by columnar epithelium. Animals in utero are especially vulnerable, and if deficiency is severe, then born dead and perinatal mortality can be expected to increase, particularly during cold and wet weather due to the inability of iodine deficient lambs to regulate body temperature. Animals that survive may be small, weak and hairless. Mild iodine deficiency does not affect the growth of lambs, but wool production can be impaired. Diagnostic criteria, i.e. biochemical measurements of tissues, don't provide a reliable indication of whether animals will or will not respond to iodine supplementation. For instance, serum T4 and T3 concentrations are routinely tested, but these are poorly correlated with clinically defined outcomes and were found to be unhelpful in predicting the reproductive performance of flocks given iodine supplementation. Serum total inorganic iodine, or STIC, does reflect changes in animal iodine status in that it increases proportionately with iodine supplementation. However, it's not a sensitive indicator of all aspects of iodine metabolism. The STIC of pregnant ewes was not influenced by the presence of goitrogens and that exacerbated goiter in newborn lambs. These ewes were fed either pasture or brassica kale during the latter half of gestation, yet average stick of the groups were similar. The situation cattle criteria is also unreliable. T4 concentrations in a New Zealand dairy herd were observed to vary with season by twofold and stick by threefold. Concentrations of T3 measured over 12 months showed no correlation with stick, and concentrations of T4 in dams did not predict the presence or absence of thyroid hyperplasia in stillborn calves. After supplementation pre-mating with 1600 milligrams of long-acting injectable iodine, stick increased twofold, but T4 did not change. Similarly, stick was increased in dairy cows given 3 injections of 2,400 milligrams of iodine, but there was no effect on T3 or T4. It may be that hormone concentrations remain stable when supplemented cows already have enough iodine for their immediate metabolic needs. Despite the limitations of biochemical measurements, practitioners may feel that provisional reference ranges are better than nothing, so these are provided. Values that fall intermediate indicate marginal iodine status, and further assessment of a flock or herd is warranted. Until such time that a more reliable tissue criterion becomes established, evaluating the thyroid weight to birth weight ratio in grams per kilogram of newborn lambs and calves is a satisfactory, albeit low-tech and inexpensive way to determine iodine status. This index can identify exposure to dietary goitrogens and has been related to iodine supplementation responses in sheep flocks. Thyroid weights and birth weights can be measured when slinked lambs are necropsied, preferably from 5 to 15 lambs per flock. Lambs with ratios less than 0.4 grams per kilogram are considered to have a normal physiology and adequate iodine status, while ratios greater than 0.8 grams per kilogram indicate with high probability that the flock will benefit if iodine supplementation is administered the following year. Iodine deficiency seems to be less common among grazing dairy cattle than among sheep, although it is occasionally reported. For example, goiter occurred on 5 of 12 farms in the Manawa 2, reported by Anderson in 2007. Histologically perturbed thyroid glands were observed in approximately 15% of 40 stillborn calves from those farms, and 60% had glands larger than 14 grams, which is considered indicative of goiter. Hyperplasia has been observed in the glands of calves that had thyroid birth weight ratios averaging either 0.42, 0.7 and 0.72 from different studies, while normal gland condition was associated with ratios of 0.27, 0.45 and 0.28 respectively. From these data, ranges for thyroid weight to birth weight ratios have been proposed whereby less than 0.3 grams per kilogram is considered normal physiology and adequate iodine status, while ratios greater than 0.7 grams per kilogram indicate likely iodine deficiency. Intermediate values may or may not be goitrous. Fetal and newborn animals are most vulnerable to iodine deficiency, so on-farm strategies for treatment and prevention should focus on getting iodine supplements exactly where they are needed. Supplementing dams pre-mating or during gestation is efficacious and is usually a convenient method. Attributes of improved reproductive performance, such as an increase in lambing percentage, often in the range of 14 to 21%, and decreased perinatal mortality have been reported in flocks supplemented with iodine at 3 to 4 weeks pre-mating. When a herd of 200 cows was supplemented pre-mating with 1600 milligrams of long-acting injectable iodine, the pregnancy rate among initially anestrus cows, that was 26 days after the planned start of mating, improved 14% with a p-value of 0.1. However, no other indices of reproductive performance, including proportion of stillbirths and perinatal calf losses, benefited from the iodine treatment. While the decision to supplement should usually be based on evidence or the history of iodine deficiency, if winter feeding of brassica crops is planned, then pregnant cows and sheep should always be supplemented with iodine as a precaution. Supplements are available in a variety of physical and chemical forms that differ in their efficacies. Iodine can be administered at farm level or to the individual animal. Supplementation methods applied to the entire farm, such as top dressing, pasture spraying, water supply treatments, and salt blocks, are not recommended. The amount of iodine that reaches the intended animals can be widely variable. This is partly because iodine molecules are volatile and dissipate unpredictably into the environment, more so than selenium, cobalt, and copper molecules do. Direct treatment of animals can be effective for short periods. Oral drench solutions containing potassium iodide or sodium iodide are available. A typical dose rate for pregnant ewes that are fed brassica crops during gestation is 3 to 4 milligrams of iodine per kilogram live weight, which equates to approximately 200 milligrams of iodine for a ewe, administered at 8 weeks and again at 4 weeks prior to lambing. This will prevent goiter in the lambs. Soluble chemical forms of iodine are often included in anthelmintic drenches, but the timing of iodine supplementation needs to be strategic, using the appropriate product and accommodating the animal's biology. Be aware that for mineralized anthelmintic drenches, the preferred time for parasite control might not coincide with the optimal time for a trace element supplement. For much longer efficacy, the use of intramuscular injection of iodized oil, such as flexidine, which is a restricted veterinary medicine, contains 26% of iodine, where the atoms of iodine are covalently bound to the fatty acid molecules of the oil. Administration pre-mating or during gestation to provide 4 to 7 milligrams of iodine per kilogram of live weight, or approximately 400 milligrams of iodine per ewe, and 1600 to 2400 milligrams of iodine per cow. This has been shown in sheep to increase and maintain the stick of treated ewes for months, as well as their offspring for up to 8 weeks. Note that serum T4 levels might not be affected. Dietary iodine intake has a wide safety margin between adequate and excessive. From the dietary requirement of approximately 0.25 milligrams of iodine per kilogram of dry matter, an increase of 30-fold or more is not detrimental. Calves-fed diets containing 8 milligrams of iodine per kilogram of dry matter showed no adverse effects. However, animals grew poorly when fed 30 milligrams of iodine per kilogram of dry matter, that is 120-fold greater than requirement. Growth and reproductive performance of sheep were not affected when fed diets containing 20 milligrams of iodine per kilogram of dry matter, but was when diets reached 42 milligrams of iodine per kilogram of dry matter. It seems likely that the safe upper limit for dietary iodine intake lies between 8 and 30 milligrams of iodine per kilogram of dry matter. So in summary, iodine is an elemental constituent of the thyroid hormones that regulate energy metabolism, protein synthesis, and cell differentiation. Newborn ruminants are particularly susceptible to iodine deficiency, and that it can cause goiter or enlarged thyroid gland, and high perinatal mortality. Sufficient exposure to iodine in utero is crucial for fetal development. Under pastoral systems, the risk of iodine deficiency to pregnant dams and their offspring is greater when brassica crops, such as kale and swedes, are fed in the latter half of gestation. These feeds are low in iodine and contain goitrogenic compounds that can interfere with iodine metabolism. Utilization of dietary iodine is influenced by environmental factors, diet composition, and the presence of goitrogens, and these confound the apparent requirement for iodine intake. As a guideline, 0.2 to 0.25 milligrams of iodine per kilogram of dry matter should be sufficient for grazing sheep and cattle under most circumstances. Marginal iodine deficiency is difficult to diagnose. Diet composition is a poor predictor of the iodine status of animals, and biochemical criterion, e.g. serum measurements, often fail to discriminate between adequate and potentially deficient status, or animals that have been exposed to goitrogens. Iodine deficiency is reflected in the incidence and severity of goiter in newborns of flocks and herds. A thyroid body weight ratio in grams per kilogram of less than 0.4 in lambs and less than 0.3 in calves is normal for adequate iodine status. Studies with sheep have shown that ratios greater than 0.8 are strongly indicative of enlarged thyroid due to iodine deficiency, and there is a high probability that the flock will benefit from iodine supplementation. Strategies for iodine supplementation should focus on direct administration to the individual animal, as farm-level methods such as top dressing, pasture spraying, water supply treatments and salt blocks are widely variable in their delivery. Options include an aqueous oral supplement, mineralized anthelmintic drench, which are effective for 3 to 4 weeks, intraruminal boluses, or most preferably long-acting intramuscular injection, which can be effective for 6 to 8 months. All pregnant animals fed brassicas should be supplemented with iodine, and this will protect the offspring. Well, many thanks for that. That was a quick run through of iodine. I hope I didn't lose you along the way, and that it all makes sense. So thanks very much for your attention.